Hey there, it's Randy Wolf with QuoteMyMedicare.org, and going to be doing a live video today. It's Monday, about 10 minutes or so till 9, and I wanted Eastern time, and I wanted to do a live video because a lot of the videos that I've been doing, I do pre-recorded videos, but some studies and statistics show that live videos get better engagement and people like live videos more. So this video may be pretty terrible because I'm typically not used to doing live videos, and a lot of times with pre-recorded videos I edit them a lot, and which is kind of a nice feature to be able to do that when I mess up. But so bear with me. But today this video is going to be short. It's just dealing with some important dates regarding Medicare. So we're in August right now, and coming up is the annual enrollment period, and this takes place October 15th through December the 7th. So October the 15th through December the 7th is the annual enrollment period, and basically enrolling during that period of time, if you utilize the AEP, you will have a January 1st effective date. Now this is for people who have a Medicare Advantage plan or for people who have a Part D prescription drug plan. If you have a Medicare supplement, which a lot of my clients have, you know, if you're watching this and follow our page here, a lot of you have both. You know, we have a lot of Medicare Advantage clients, we have a lot of Medicare supplement clients. So right now I'm talking particularly about Medicare Advantage and Part D. Many of you that have a Medicare supplement also have a Part D, so it's relevant. So October 15th through December the 7th, that's the annual enrollment period. Enrolling in a plan or changing a plan at that point, the coverage would start January the 1st. So that's important. Something that was added back, they had it many years ago, and then they brought it back last year, is the open enrollment period, where from January 1st through March 31st, there are situations where you can change. So as of last year, during this period of time, you could change, and they even allowed you to change from if it was the first time, from one Medicare Advantage plan to another Medicare Advantage plan. But they also would allow you to drop, if you had a Medicare Advantage, you could drop that and pick up a Part D plan, which then would allow you to enroll in a Medicare supplement if you chose to do so. One of the things that during the year you're not allowed to do is if you have a Medicare Advantage plan, you can't drop that and roll into a Medicare supplement plan during the year. The only way you could technically do that is if you had a low-income subsidy. Then you could drop an Advantage and go into a drug plan. But again, typically though, you can't do that. So during the annual enrollment period, and from October 15th through December the 7th, and then during that period from January 1st to March 31st, if you had an Advantage, you could drop that, pick up a Part D drug plan, and then also get a supplement. If you have a Medicare supplement, you know, or if you're a client of ours, or if you're not, just be aware you can change that anytime. So there is no period of time when you can change. Now there is obviously, for those of you who are going to be starting Medicare soon, there is the open enrollment for Medicare supplements, and generally for a lot of people when they turn 65, they get on Medicare, and you have basically a window of time of 6 months where you can get into a Medicare supplement plan and not have any underwriting at all. Now some states, well, not to be too overly complicated on a live video, basically if you're starting a Medicare or turning 65, there's that 6-month period. Some carriers would allow you to actually enroll up to 180 days out from your start date. So technically there's like a 6-month window before where you can set it up to start on the month you begin Medicare. There's a couple of carriers though that have changed their rules, and you know, like for example Cigna, now you can only enroll 90 days prior to the start of your Medicare A and B coverage date. So but then of course if you don't, you've got up to 6 months where you can enroll and you would have no underwriting. Now if you didn't enroll during that period of time, let's say, then you could enroll 7, 8, 9, 10 months into your Medicare supplement plan, but you would have health questions asked. So I don't know if there's any questions on here right now. Again, I don't typically do live videos, so I don't see, let me see if I press this here, it'll show me. I don't typically do live videos, I do pre-recorded videos. So, but if you have any questions, feel free to comment in the below comments area. I'll be happy to answer those. And also to be sure, if you're not already, which I guess if you're seeing this you probably are following, but be sure to follow our QuoteMyMedicare.org page on Facebook and QuoteMyMedicare.org on YouTube. We put out a lot of valuable content that can be helpful, and it may be something that if you have questions. We try to update it whenever there's changes. Usually each year when the Medicare Part B deductible and premiums change, we'll do a video about that. So as things kind of happen, I usually try to put out content so to keep you up to speed and on changes and things of that nature. So as always, thanks for watching, and I hope you have a great rest of your Monday. Thanks. Take care. Bye.